Ensuring the health and well-being of your dog starts at a very young age. Pet parents should work with their veterinarians to ensure that puppies receive the proper vaccinations to protect them from common diseases and infections. But which vaccines do you need, and how often do they need to be administered? Let's break down common puppy vaccines so you know the steps to take. Puppies should be vaccinated against canine distemper virus, hepatitis, parainfluenza, and parvovirus. These viruses and bacterial infections can cause severe health problems for dogs and even result in death. Luckily, there is one vaccination that can vaccinate dogs against all of these common illnesses. This vaccine is referred to as DHPP, and puppies generally require an injection of this combo vaccine 4 times during their first year. The first injection should happen around 6 or 7 weeks of age, another at 9 weeks, a third at 12 weeks, and the final injection around 16 weeks of age. Many veterinarians also recommend a leptospirosis vaccine when the puppy is around 12 weeks of age. Generally, a lepto vaccine is repeated 3 to 4 weeks later and administered yearly after the initial vaccination. A rabies vaccine is also recommended and oftentimes required by state and local laws. Rabies vaccines should be administered between 12 and 16 weeks of age, and rabies booster vaccines are generally required every 1 to 3 years, depending on the requirements of your state or local municipality. Other vaccines that may be recommended, depending upon your dog's lifestyle, are kennel cough, Lyme disease, and canine influenza vaccines. Talk with your veterinarian about which of these may be appropriate for your pup. Once these initial vaccinations are complete, it's important to work with a veterinarian to ensure that your dog continues receiving appropriate vaccinations and boosters throughout his or her adult life. While the majority of veterinarians consider common vaccinations safe and effective, some dogs may experience vaccine side effects. Discomfort or tenderness around the injection area is not uncommon. General tiredness may also result from certain vaccines. If your puppy experiences any trouble breathing, seems to be having an allergic reaction, shows signs of weakness, vomiting, or diarrhea, or has pale gums following a vaccination, you should call your veterinarian immediately.